Hello. Okay, thank you so much. You're here with the Center for Cultural Power and the Cultural Engagement Lab for our Culture Couch series. We are discussing culture and joy as a political strategy. Today we are with Ms. Ashlee Wisdom, who is the founder of Health In Her HUE, a digital platform designed to help women navigate their health with collective content, connecting them to culturally competent healthcare providers. And I could let her tell it better than I ever could. But yes, thank you Ashley so much for being here with us.
Of course,
today.
thank you for having me.
Yes. And so I want to just tell us about Health In Her HUE.
Yeah, so the genesis of Health In Her HUE really came from my experience working within the U.S. healthcare system. As a public health professional, I've worked in different healthcare settings and just saw consistently that the healthcare system was just not designed to be safe and affirming to women who look like me. And then when I was in grad school, I was learning about all the different factors that lead to Black women having the poorest health outcomes. And I started thinking, we have all this data. Why do I not see anyone building solutions that are really designed to meet the very specific needs that Black women have? And so I decided I was going to take my public health professional background and build a solution that helped Black women safely navigate this precarious healthcare system.
So yeah, I'm a public health baddie, so
Thank
absolutely. And so I guess if you could share more, what does it mean for a provider to be culturally competent?
Yeah, so I think about, and sometimes I use the word culturally responsive care more than cultural competency, because the prevailing thought is that someone else can really be competent in someone else's lived experience or culture. But to answer that question, culturally competent care or culturally responsive care is really providing care to a patient, centering their lived experiences, taking into account their culture, how they show up in the world, the different things and factors that are impacting their health and the environment that they live in, and giving care to them in a way that's affirming and responsive to how they show up in the world.
Absolutely. All right, so we're gonna dig in. So we're here, we're in Martha's Vineyard, we're in Oak Bluffs, and there's so many conversations happening around, right, around elitism, capitalism, all the things, right? And it's a fair conversation, obviously, right? Because the rich history that lives here also can sometimes not feel accessible to everyone. And I guess thinking about you and wanting to create access in healthcare systems, what are your thoughts about that, right? Like, how does the conversation of elitism, capitalism, socioeconomic separation really further Black women health disparities?
Well, I always like to address the elephant in the room. Health In Her HUE is a for-profit company. I've raised venture capital, so definitely am navigating in the thick of capitalism.
Of course.
But that said, that doesn't mean that capitalism or systems are of critique. And so this conversation around classism and elitism within the Black community it's an important one, because the way I always like to say that, call out that a lot of times we talk about racism, but racism isn't the only tool and factor that keeps us divided under this capitalistic system. Wealth and economic inequality is a driving factor in us staying divided, and it's a tool of capitalism to keep us divided. And so it's important for us to always keep that lens on. It's very easy to ascend and be upwardly mobile and forget that we can't ignore the structural factors that cause some people who look like us to not have access to the same resources that we have. And if we care about the community, our individual success, our individual access to those resources does not benefit the entire community. And so we need to think through systems and structures and ways that, and think through ways that we can help make sure that the community as a whole is doing well.
That's right. I hear you. I definitely appreciate the structural lens to all of that, right? I also just addressing the elephant in the room too. We're a nonprofit and we're also in the thick of capitalism. We do grant funding, so I definitely understand that, right? And I think the nature of where we are in the world and wanting to raise, and I think the most ethical we can be, if that's possible, is how we pull these resources back into our communities, right? So I think about cultural power and the work that we do and making sure that artists in the creative economy, which is a lot of people of color, can receive and be resourced to do what they do, get healthcare in spaces like that. And obviously the work that you're doing with Health In Her HUE, making sure that those resources are funneling back into community. And I definitely hear you. We can't ignore it. We also cannot be a barrier, because sometimes, right, we we do ascend. I think about this conversation of jumping class often because that's the conversation I'm living in my personal life, right? And making sure that not only do I not ignore it, but I also don't become the barrier for folks as well, same. Right? Like that I don't say, now that I figured it out, you know, good luck. Right? So I'm going to talk about the current administration. So now that the current administration has defunded Medicaid, there are going to be a lot of low-income people who are forced to work for poverty wages, who are going to lose their health insurance. How are you thinking about helping Black women find affordable health care with this government funding gap?
Yeah, so it's a very unfortunate situation that we're in, having to exist under this administration. And we knew, as Black women, we knew that exactly what's happening was likely to happen if this administration came back into office. And so I always say that the work of Health In Her HUE was prepared for this moment. Even if this administration wasn't in office, the healthcare system just was never really designed to meet the needs of women of color. But it's even worse now because a lot of Black women rely on Medicaid, especially Black pregnant women, birthing people. And so it's a very precarious climate right now for Black people, women of color, looking for healthcare, navigating the system. What Health In Her HUE is positioned to do is support women with finding resources. And right now, my team and I are trying to be even more creative and think through what are the resources or places that we can help connect women who may have lost their insurance because of the Medicaid cuts. How can we connect them to FQ, to use acronyms, federally federally qualified health centers, which are community health centers that provide care to patients irrespective of their insurance coverage. And so they charge patients based on their income. And so now that some women may be uninsured or underinsured, how can we use the Health In Her HUE platform, our directory, to not just connect women to providers who are culturally responsive, because some of those providers work for hospitals or practices that only accept insurance, but if we can connect women to FQHCs, federally qualified health centers, community health centers that will provide care to them irrespective of their insurance status, that's one way that we can help bridge this access gap in this current political climate.
Amazing. When you said FQH, I was like, okay, yes, I remember this, right? So definitely being in your public health presence is really unlocking some old memories, some old training. So your business has been extremely successful. You're just the whole venture, all of it, right? In both the venture capital landscape where Black women are extremely minoritized, right? And it's taken off in popularity, right? And so you got followers and you have people who are just really rooting for you, of course. And so can you tell us about how you leveraged internet culture to really jumpstart this idea and sustain it?
Yeah, I love this question so much because it gives me the opportunity to share how important and instrumental community was and has been to the success of Health In Her HUE. When I had this big vision in my head of wanting to create a solution that would be meaningful to Black women, I remember thinking, like, I'm just one Black woman with one very particular lived experience. So there's no way in which I can create a solution that's going to be a panacea for all Black women, because I don't know the lived experiences of all Black women, even though I am a Black woman myself. And so one of the first things I built before ever building an actual product was a community around the mission and vision of Health In Her HUE, which was to reduce racial health disparities for Black women by leveraging the power of technology, media, and community. And that mission really resonated with Black women. We really focused on creating content that connected culture to healthcare, and women were engaging with the content that we were posting on social media. Mind you, back then, this was before like doctor influencers. No one was really using social media. So I was like nerding out and reading academic papers while I was in grad school and taking the most pertinent information and turning it into really accessible information and connecting it to culture. And Black women started following the Health In Her HUE social media accounts in our blog. And from there, I built a community on social media and started to learn from Black women about what were their healthcare experiences, what was it that they were wanting and needing from healthcare. And I used that to inform what products we were going to build. And so our first product went viral because I listened to what the community was saying. They were like, either I've had a negative experience with a provider, and so I really want to find Black doctors and healthcare professionals, or I'm seeing all these headlines about Black women dying from maternal mortality. And so it's really important for me to find a provider who I can trust to see my lived experience and my humanity and give me care in that way. And so that was the impetus for us building this provider directory to make it easier for Black women to find culturally responsive providers and providers who look like us. And it went viral. The community was like, this. It only had 6 doctors on it at the time. And the community was like, this is brilliant. I've always wanted something like this. Like, how do we make this successful? Can more doctors sign up and join the platform? And it has literally been Black women who are just everyday Black women who are doctors, Black men too, who have said like this solution needs to exist and have supported in making it become as popular as it has become.
I love that. I love it. The ways, because sometimes people can create narratives around sort of where and how our community shows up. And like we're very present in these conversations, right? And sometimes they can feel disconnected, but they're still happening. And so I think cultural strategy, which is what I hear you're doing, right, is the ways in which community comes together and is able to help create those solutions and support you in helping to do that for us. So I hear that and I'm like, yes, cultural strategy for the win. Oh, influencer. Wow. That's like just thinking about that before there were doctor influencers. I'm like, that was a time. It was a long time.
The doctors were creative using social media. They're like, I want anyone still with me.
Exactly. This is now they be in the rooms. They be in the ORs taking videos. That's not shade. I love it. I actually follow all of you. So we just talked about actually utilizing culture and sort of cultural strategy. How do you think the arts has helped spread the good word about your organization? If so, namely to sort of meet Black women where they are, right? Sort of, I think I witnessed you sort of like venturing into TikTok, and I know TikTok has a place for a lot of artists and creatives. So I'm wondering if arts and music or anything you feel has also helped being a connective dot for you or a connective tissue between you and artists.
Absolutely. So I'm a creative by nature, and so I remember, but I'm also a nerd. So I have both, left, right brain, but I skew more creative. And I remember thinking, I love public health because I care about policy. I nerd out on that stuff, but it's not sexy.
It's not.
And so how can I make this information and some of these concepts that are life-saving more, I don't even want to just use the word accessible, but actually relevant to Black women, to Black people, and so that they're equipped to manage their health and engage in shared decision-making. And one of the ways to do that is to connect healthcare topics and ideas to things that people are already paying attention to and engaging with. And now a lot of times that can be celebrities, that can be artists, that can be music. So in my early days, I was the one doing all the Health In Her HUE posts on Instagram. And so I'm like, all right, I want to do a post about diabetes or fibroids, but if I just post about fibroids, that's probably not going to resonate. But if I can find a Black woman celebrity who I know Black women love and are connected with and they love their music, and I highlight their experience with a specific condition, that's more likely to get a Black woman to be like, Tia Mori also has endometriosis, and this is how she navigated it. And she's an actress, and I love watching her on Sister, so I want to know more about her and how she navigated this condition as a Black woman. Making those connections between artists and Black culture and connecting it to health has been the thing that I'm super passionate about, and that I've seen that women have been really responsive to.
I love that. Okay, I'm just. I always joke I'm not creative because I live in the more policy, nerdy, legal law space as well. So I always love when I hear folks are like, actually no, I live in both, and so maybe I'll lean into that for myself one day.
It's fun over here.
In policy, it isn't sexy, but when you really get into it, I think it's obviously it can be fun, and I think for me the biggest joy has been, even through this work, but even in my previous work, helping folks to also learn and see, right? If I got to go into the room with the door knockers for you to, I'm gonna do it, right? And that too is cultural strategy. Yep. So I hear you. All right, you're gonna love this question. What do the terms Black excellence and Black girl magic mean to you?
Ooh, Black excellence. That's another one that has become a bit controversial.
I know.
I don't like to think of Black excellence within the realm of Black exceptionalism, because a lot of times, and I'm not someone who leans into being tokenized or that I'm yes, I'm brilliant, but I know that Black people are brilliant people.
Yes,
and sometimes the only thing that's the difference between someone being perceived as exceptional is the access that they've had to certain resources and opportunities, and someone else just not having that. And so I think excellence is just being brilliant, being authentic, being your full self at whatever it is that you're doing and excelling at that thing. Not trying to, go after the artificial idea of what success is. I know that Black people are capable of making a way out of no way. And it's an unfortunate thing that we've had to contend with, just not having access to resources for structural purposes. But the beautiful thing that has come out of that is that we are able to take the bare minimum and turn it into something super beautiful. And I think that that is a prime example of what Black excellence is.
Our culture, right? Like, I think a lot of Black culture was built in resistance to dominant systems and structures, right? And look where it's taken us and look how it holds us and unites us. So I definitely in agreement. And Black Girl Magic.
Oh, Black Girl Magic is just, we set culture. We set the trends. Like,
girls.
Some of the things that I see popping up on like TikTok, and I'm like, that's part of like Black girlhood.
Yes.
And people are trying to repackage it into something else, and it's like, no, we do that. So I think Black Girl Magic is setting trends, setting culture, and we're a very communal people. So even when folks try to do the whole cultural appropriation thing, that's problematic. But if you want to engage with us in our culture, in our creativity, in our brilliance, we don't gatekeep. People try to extract and be extractive, and that's problematic. But we tend to be welcoming and open. And I think that that's also part of our magic, that we are brilliant, we're creative, and we're willing to share that. We don't hoard things just amongst ourselves.
We don't hoard. We might have to hold back on some of the cookout invitations.
Everybody can't be invited to the cookout just because they can do it alone.
Just they do like a 2-step, and we're like, you can come. No. I'm gonna need to read your politics a little. Okay, and then lastly, so we're in the middle of running our campaign, which is called Autonomy is My Joy. It's around gender justice, health equity, all the things, right? Because we know that they all live with the intersections, right? Built environment to repro to all the things. And so I want to know, what does autonomy mean to you?
I love the word autonomy because I'm someone who just loves to be free. It really is. It can be a little, I don't want to say problematic, but I really don't like hierarchies. Autonomy means just having the latitude, the freedom to exist, to be who you're born and created to be. Literally being the person and individual that the Creator created and purposed you to be on this earth to be, and not having anything, being unencumbered in that ability to show up in your authentic self.
So be Black Baptist Day. Amen. That's right, who the Creator created us to be. I thank you so much on behalf of our artists and movement partners, just the work that you're doing, our audience, whoever's out there. We're just so grateful to have Ms. Ashlee Wisdom here with us, founder of Health In Her HUE, just doing this work, fighting for us, bringing the skills that were given to her and using them to be a tool and a resource for us.
Thank you. It's my privilege and honor to do this work.
That was Ashlee Wisdom, founder of Health In Her HUE. Be sure to check out the rest of our Vineyard Culture Couch series, Culture and Joy as Political Resistance. More to come. Have a good one.